Kahnawake wat kunuarado, Aruhya Gaya de Ujats, Negi, the Kahnawake COVID-19 Task Force Daily Briefing. Today is Wednesday, June 10th, episode number 87, Sidney Crosby's favorite episode. He's busy practicing for the Montreal Canadiens, but we got somebody even better. Ietsénhaienhs Gina is here to talk about the Kahnawake Emergency Relief Measures Fund.
Kahnawake. I'm here today to give a bit of an update on the Emergency Relief Fund. So I have been informed that to date for the individual fund, individual persons, we've given out over $5 million. We have been looking at the business side of it. I do not have the numbers with me today to see what has been given out to date, but there have been some issues around the rentals. We have had to take some steps and do in the process reviews of the rents. We have had significant amounts that have been claimed, so the board has decided that we would look at each individual case. Now, I know people have been telling, each other like, oh, we're not going to receive rent. This was necessary for us to reopen our business. Well, you will receive rent. It's just that we have to look at each case to look and see what is required. Some people have the ability to have deferred payments. So we want to facilitate that process if it's available to people. We have been looking at this as a case-by-case situation. The reason for that being is as the monies are going out, we've realized that there's a lot of discussion around a second wave. That is the fear, is being able to support businesses in the event that there is a second wave. As I stated earlier, we are over $5 million when it comes to individual claims. So with the businesses, we're not sure what that tally will be. So we're asking people who are claiming for their business to inform the landlords of those businesses to get in touch with us. We want to see if we can help facilitate the process of either a deferred payment, a decreased payment, and in the cases where that's not possible, then we will work with them to ensure that they can get some dollars. This is a as-needed basis. A lot of the talk around the community is, well, this is free money, and we want to emphasize that it's not free money. This money is coming out of the community coffers, and we're trying to be responsible, we're trying to be fair, and we're trying to be reasonable. So in order to stretch that dollar, we have to do some due diligence. I mentioned today on the radio that we had claims, for 8,000, 13,000, and the question is it responsible to be giving out these amounts of money? Is it necessary for these businesses to continue to operate with those sort of rents, or is there something that can be looked at? So that's where we're at. We're doing our best at this time to try and help people get through the crisis. We want to emphasize again that we are not replacing lost revenues. We are just trying to carry you through so that when you're able to reopen, your business is in a position to reopen with as little impact as possible. But again, we're not replacing lost revenues. The KERM is going to be extended. We're coming to the end of the 90 days. So we're looking at bringing it back to council to have an extension. For those people who go back to work, we want to ensure that they will have some monies coming in. So we're extending them by a week once they return to work. And currently there are over 300 people who are returning to work. So that's some good news. Out of the 900 applications, there's over 300. So one day at a time, we're taking our cues with the task force, and they're going to, let us know what will open, and businesses are giving us information as far as who is returning to work in their establishments. So it's been very helpful. We hope that the community will continue to cooperate, give us information about the dates when they're opening and the needs for their employees. So we're doing a good job, Kahnawake. We're slowly getting back there. Thanks. Hana.
Now, Gina. And just a reminder, if you want any information about the Kahnawake Emergency Relief Fund, just go to kahnawake.com/relief. Our next guest to join us today is Executive Director of the Academy Memorial Hospital Center, Lisa Westaway.
Thank you. Good afternoon. So I'm here today to talk a little bit about KMHC in particular, so not necessarily about task force updates, but really about the hospital. And I want to specifically talk about inpatient. So as you're well aware, it's been just over 3 months now since we've had to close our doors to visitors on inpatient. And this has been very, very difficult for many people, for all of you, who are unable to visit your loved ones, unable to have meaningful connections with them, and it's very difficult for them as well. Some of the things that we've spoken about over the course of the 3 months, some of the things that we've implemented are calls 2 times a week to family members. We were lucky enough to get iPads donated, so we've created iPad connections, not at all the same as personal in-person contact, but still something. We've increased activities that happen on a one-on-one basis so that we're really focusing on psychological and mental well-being as well as physical health. We've started doing some videos that we've posted also on Facebook Live, and we continue that as we speak. So although these elements have been put in place, staff have been especially attentive. Nothing replaces the connection from loved ones. And so both for you and for your loved one at KMHC, this has been especially difficult. And although I do let you know that mental well-being, psychological well-being is that for all residents they're doing well. It doesn't mean that they're perfectly happy. As I said, as much as our staff do, as dedicated and loving and caring as they are, that cannot replace the connection from you who were coming to visit. So one other thing that's been very, very difficult since the beginning, so over the last 3 months, besides that lack of connection, is families' inability to participate in decision making with respect to many of the decisions that we've made at KMHC. So we're well aware of this. We had to make some very urgent, drastic decisions very quickly, which did not allow for family consultation. And this is not the norm at KMHC. This is not the norm for Kahnawake. And so this has been very difficult, I understand, for all of you. And in fact, it's just as difficult for all of us. We can't apologize for having to put these measures in place really quickly without consultation, because as we look around us, we know that our elders are alive, safe, and well. But again, it doesn't change the fact that it's been especially difficult, and for that, we are very sorry that we all have to go through this in the face of this pandemic. It is huge negative consequences of the pandemic that we're living in. So as you know, we have been talking about moving towards the new normal, our revitalization strategy. What will things look like moving forward? And we can't expect to live like this for the next year and a half, 2 years, keeping you away from your loved ones. So we have, over the past several weeks, we've been working very hard on trying to look at ways that we can improve these communications between you and the residents at KMHC. And again, a lot of that is about balance. How do we ensure safety or mitigate risk as much as possible? How do we ensure mental, psychological, spiritual, physical well-being? How do we find that balance that works so that we all can move forward in a way that we're comfortable with and that is safe and healthy? These are all very difficult decisions to think about. And if we look at timeline, it has been, and I may not have communicated this well, but part of the timeline of events where we're at now in terms of redoing the community health check, a second time looking at what's happening in Kahnawake, looking at our testing site numbers. These are all measures that we have been waiting to analyze in order to move forward on some of the plans that have been in the works for the last few weeks. So I wanted to tell you about some of these plans. You'll be hearing more about them as we move forward, but I think they're important to communicate at this time. So the first thing to let you know about is we're in the process of working with the Users Committee, and we have a meeting on Friday to look at this more closely. But what we'd like to do is organize a Zoom meeting with families, so with a representative for each of our residents. So you'll be getting a lot more information about that next week, and I hope to have it organized by next week or the week after. And the important part about this meeting is to really have a better understanding of what's important for you, what do you feel is important for your loved ones, so that the decisions we make moving forward take into account your point of view and your wishes for your family. Other things that are being currently organized are outside activities. So as you've seen in the past, Muchi has been there twice. We're looking at organizing other activities. I will not announce those dates or those plans on Facebook Live because they really are events for residents and for their loved ones, but we'll be communicating with family members by telephone to let you know of when those events will be organized. We're also in the process of organizing a Father's Day drop-off, which will be very, very similar to Mother's Day drop-off. That will be on the 21st, which is Father's Day. And the time and specifics and details about that, again, will be organized and communicated to you next week. Following the Father's Day drop-off, what we are planning to organize is a drop-off every 2 weeks. The reason why these drop-offs are really important is because a huge element of connection between you and your loved ones in the past has always been to bring in items for your loved ones, whether it be a special shampoo or a chocolate bar or you know, something special. So we want to reinstate that on a regular basis and ensuring, of course, that we're protecting your loved ones by cleaning, sanitizing, putting all of the safety measures in place to ensure that they're safe as well. We're also looking at new communication tools. So right now you're getting phone calls or we have iPads, but we're really trying to find ways that we can more freely communicate back and forth with you, whether it be one of our workers or your loved one, or by sending videos to you directly so that you see your loved one in action, either in the garden or doing a special activity. So that's something that we're in the process of organizing right now. And I guess the last thing that I want to let you know about is, although we can't open the doors to visitation, we're in the process of organizing to be able to have 30-minute face-to-face visitation at a really safe distance. So it would be approximately 15 feet, so a little bit larger than the 2-meter distance or the 6 feet distance that we talk about, but we pretty much have this plan organized. There's just a few elements left to put in place, and we would be calling each of you to set appointments so that you can come visit. So that's in the process, and hopefully when we get more concrete data from the beginnings of the health check and our testing numbers, then at that point we'll start scheduling appointments. So you could expect that to happen within about a week and a half or so. So I just wanted to give you that information. Again, we have a meeting with the Users Committee on Friday where we'll be discussing these elements in more detail, organizing the Zoom meeting for families, and you'll be getting a call from somebody from KMHC over the next week to talk to you a little bit also about the outdoor activities that are being planned so that you can be present. we know that this has been really difficult. It's been difficult for all of us. It's not a fun situation that we're living. We are all doing the absolute best that we can under the circumstances. And I really want to thank all of you for participating, because you do. By respecting the measures that are in place, by protecting your loved ones, you participate as much as we do. And the difficulty is there for all of us. So thank you for your patience, and we look forward to putting these new measures in place over the coming weeks. Thank you.
All right, thank you, Lisa. So families can check the KMHC website for more information. Keep on the lookout for that. Just a program note, Joe Delarone, the host you're used to seeing, will be back on Monday, June 15th. But without further ado, the man you're used to seeing here on the program, Commissioner of Public Safety, Lloyd Phillips, is here now with his update.
Thank you, Neil. Thank you, Lisa, for that update. It's good to hear. As somebody who has parents at Kahnawake Memorial Hospital Center, I'm certainly glad to see that there's evolution happening in terms of ensuring that there's more safe ways of being in contact with your loved ones. No, that's just one example of the way things are gradually evolving in the community in terms of how the pandemic is impacting us. And Gina also talked on it regarding the KERM fund, and things are evolving there. So things are evolving, basically, across the community, and obviously, across the province and across Canada. So we want to take it step by step and ensure that we're moving in a manner that is remains the community as safe as we possibly can. With that said, today we did not have a task force meeting. But there has been a lot of work that's in the process of being developed. We are preparing for the next phases of the pandemic, and phase 2 of business opening is obviously something I'm sure that's on a lot of people's mind. So we're making sure we're gathering all the proper safety criteria that's going to be required by them. Ensure that we're going to be communicating that directly to the people who have these businesses. We'll be posting it on KMHC website where all their information regarding businesses has been posted, and we'll making sure people are aware what will be expected of them when we get into phase 2, and much or unlike, I should say, phase 1, the phase 2 is much more complicated. That's why it was segregated off from the first phase. Retail and construction and things of that nature were more, although complex, was more easier to figure out safe way of doing it. But when you're talking about stuff that is very complex and like restaurants and bars and gaming facilities where there's a lot of people, there's a lot of touch surface, a lot of contact, it's very complex and to figure out how you can navigate all that stuff. Some other stuff, we're talking about also hair salons and beauty parlors and manicures and stuff of that nature. There's also some ways of doing that safely, but we just want to make sure that that's all planned out properly, and obviously the people who are involved are also properly knowledgeable of the regulations. Again, always under the name of public safety. So it doesn't mean that everything in phase 2 will roll out at the same time. Actually, I could say for sure, not everything will roll out at the same time in terms of phase 2. Unlike in phase 1 where it was one big chunk. So we'll move accordingly as we do. We're also looking at the other side of the coin here, so to speak, on the more social side. If you may have heard that Quebec has announced starting soon, they're going to be looking at indoor gatherings on how that could take place in a safe manner. We're looking at something very similar as well, looking at the rationale behind having or allowing for indoor gatherings. Obviously, always safe distancing is always the key role there. But we're looking at something very similar in the community. We're going to be doing a little bit more research on that, obviously doing our proper consulting and then get back to the community on that side. That's obviously not business related, but that's more on a personal level. As well as looking at the possibility of some limited, mind you, but outdoor recreational activities, to allow people to have more time to get in the outdoors and take on various sporting elements in the community. So those are also being considered, being looked at on how these things could roll out and be done in a safe and proper manner. As well as outdoor like gym activities is another request, and another thing that we're looking at for people who want to exercise in the outdoors and as a group, but again separate it properly, but have some type of group sessions on exercising. So things like that. And again, some of that stuff, obviously a lot of details got to be worked out. But I just want to let people know, because we are looking at multiple ways of continuing the evolution of the pandemic, doing it in a safe and proper manner, and we will do this again in a phased approach. There's maybe small things over the next week or so that we could modify and gradually open up. But in terms of any major decisions, we obviously want to wait for the health check, which has started. KMHC is in the process of doing that now. So that's going to take another week or so, where we're going to actually get another snapshot of the general health status of the community, and that will give us a very strong tool for us to look at as a task force and deciding when the next steps should kick in, and look at some time frames. That's one major tool that we really want to focus on. But obviously, we're looking at the larger picture as well. What's happening in Montreal? What's happening in Quebec? What's happening in Canada? And how we fit in that, and make those decisions. Certainly, it's been a interesting time. This past week, trying to gather this information and pulling things together. But just reflecting back quickly. Because Lisa mentioned it about some of the tough decisions that were made early on, regarding Calgary Memorial Hospital Center and the decision to close the doors to visitors, which I fully support. It was a very tough decision, and many tough decisions were made throughout the past several months, by the task force and by the community as a whole. And I could say with certainty that there are very few things in the past few months that are black and white. So we're operating in a big gray zone, and we're navigating the best we can, with the best minds, the best resources, and the best advice we can get, to keep steering our community in the right direction. So with that said, I'll see you again soon, and Kahnawake.
All right, now Lloyd. There were a few things we just wanted to wrap up the show with, a few notes. Lisa let me know that KSCS is also working on similar plans as they are, and the thing we said earlier about checking out the website, KMHC.ca, I believe just wait for those to, they wouldn't be up there until they're finalized. Those plans are finalized, so don't go check now. We're actually hoping to have a representative of KSCS on in the next week or so, nothing confirmed. There was also yesterday, there was a notice put out, a communique from the task force on different updates on directives. So I'll just go over those. It was late yesterday. It wasn't on the update. It was Lloyd talked about it this morning on Facebook Live on K103. So I'll just go over those real quick. So one of them was the U.S. border. So if you're crossing the U.S. border, you are required to self-isolate for 14 days still. That's still in effect. They may change that, but nothing has been set. That's the way, that's for everybody. If you leave Quebec, if you stay within Canada, but you leave the province of Quebec, it's recommended to self-isolate for 14 days, so not required, but recommended. Organizations, if you belong to one of the 9 major organizations in Kahnawake, you are not allowed to leave the province, I believe. That still stands. I believe that was put out in early March, and you are not supposed to be leaving the province. The next thing was just for businesses. I believe it was more of a recommendation. If businesses wanted to make it mandatory for customers to wear masks, that is recommended by the task force. That was part of that directive that went out yesterday. It is a business decision. That recommendation was actually began from hearing from employees. So those are just some of the things that went out yesterday, just to send reminders, and that'll wrap it up for today's show. We'll see you again tomorrow. Nyawa.